This video is for the musculoskeletal system. We're going to talk about joint pains, growing pains, swelling, all sorts of things, movement modalities. So let's just go ahead and dive in. Dr. Petersons, where would you like to start?
Yeah, so musculoskeletal, first kind of narrowing in on, muscle, bone, or joint, where the pain is located, and then what the sensation of the pain is. So is it throbbing? Is it pulsating? Is it stabbing? Is it stinging? Is it burning? Is it bruised? Is it aching? And then what positions make it better or worse? So twisting, bending forward, bending backward, putting your head below your waist, movement or lack thereof, right? Does movement make it better or worse? Does laying in a bed make it better or worse?
Heat, temperature differences, applications. So is it worse in a cold room? Is it worse with cold applications? If you get into a hot tub, is it better? Do you have to have it as hot as you possibly can? Like to the point that if you're like in a hot shower, if you get even like a toe out of the water, does that make things worse? That kind of thing can also make a really big difference. We talked a little bit about gait changes in the nervous system video. So if you have differences that you're noticing in like awkwardness of gait or difference of movement, that would be a really good video to check out. We can touch on it just a little bit here though. So videos are going to be more beneficial than a description in most cases when we're talking about movements. But noticing the circumstances where those movements occur, if it's all the time or if it's only in certain situations, can also be really helpful. Musculoskeletal is not like a really huge problem that we see for these kiddos. So this is probably going to be on the shorter side for videos. But if you do happen to notice something that we didn't cover in this video that is coming up, then just go back to that basics video of modalities, because that's going to help apply to just observing all of the symptoms and getting the broader picture around the symptoms that you're experiencing.
Yeah, and just when discussing pain symptoms, also like condition, location, modality, and then particularly if the pain travels anywhere, if it's moving pains, wandering pains, we call it, can be really useful if it travels from right to left, things like that, from the right knee to the left knee.
Yeah. Or even if it's not particularly like that wandering type of pain, but it radiates. So it starts here and it moves here. That type of thing can also be really useful. All right, our next video is going to be on skin in this series, so hopefully you'll check that out as well. We'll see you there.